As men age, staying healthy and energetic becomes more challenging. Cuts heal more slowly, infections last longer, and even hormones can falter. Zinc, a humble trace mineral, quietly underpins many of the body's critical processes. In fact, zinc deficiency is common in older adults and causes changes similar to accelerated aging, sometimes called immunosenescence. Every cell relies on zinc. It acts as a cofactor in hundreds of enzymes involved in DNA replication, cell division, and antioxidant defense. Zinc also keeps the immune and nervous systems running, and it's essential for wound repair. In short, even a modest zinc shortfall can ripple through the body, especially in men over 60. Key roles of zinc in the body. Zinc is involved in over 300 enzymatic reactions throughout the body. These enzymes govern growth, cell turnover, and the health of many organs. For example, zinc is critical for maintaining healthy skin, bone, gut, and nervous tissues. It supports the immune system, helping white blood cells multiply and fight infection, and drives wound healing. It also plays a role in vision via retinal metabolism and in controlling inflammation. Because of this, zinc deficiency can affect many systems. It can cause impaired digestion, reproductive problems, alopecia, hair loss, and skin issues. In older men, borderline zinc can manifest as slow-healing wounds or frequent colds. Keeping zinc levels up helps sustain these basic functions as we age. Zinc and testosterone. For men, one of zinc's best-known roles is in hormone balance and sexual health. Zinc helps make and regulate male hormones. It is needed to produce luteinizing hormone, LH, and testosterone in the testes, and studies show zinc helps convert testosterone into its active form. Low zinc blunts these processes. Men with zinc deficiency tend to have underdeveloped testes, poor sperm counts, and lower serum testosterone. Men, one of zinc's best-known roles is in hormone balance and sexual health. Zinc helps make and regulate male hormones. One review calls zinc a hormone balancer that supports the prostate and male sexual function. Indeed, several studies find that modest zinc supplements can help raise testosterone in men who are zinc deficient, even partially offsetting the natural age-related decline in hormone levels. In practical terms, adequate zinc intake helps maintain libido, muscle mass, mood, and energy, all areas that can slip as testosterone falls in later life. Zinc for immune health and healing. Zinc is vital for a strong immune defense, a major benefit for aging men. It helps develop white blood cells, neutrophils, NK cells, and T cells, and regulates inflammation. Laboratory studies show that zinc deficiency causes a significant decline in both innate and adaptive immunity. In humans, low zinc is linked to more infections and slower recovery. For example, zinc-deficient seniors take longer to heal wounds and are more likely to have respiratory infections. As Harvard nutrition experts note, zinc is vital for normal immune system function and wound healing. Keeping zinc adequate can shorten colds and help cuts and ulcers close up faster. In sum, ensuring enough zinc can give an aging immune system an important boost. Cognitive and mood support. Zinc also influences brain and mental health. It's involved in neurotransmitter signaling and protects neurons from oxidative stress. Adequate zinc supports memory, attention, and mood. In contrast, zinc deficiency in older adults is associated with cognitive problems and mood changes. The ODS notes that low zinc can lead to changes in cognitive and psychological function. In practical terms, insufficient zinc can show up as forgetfulness, brain fog, or depression. Some research even suggests zinc supplementation may help slow cognitive decline in aging. While more study is needed, eating zinc-rich foods or supplementing under a doctor's guidance may help keep the mind sharp and mood stable in later years. Prostate health and zinc. The prostate gland accumulates very high levels of zinc, and for good reason. Zinc is integral to normal prostate metabolism. In healthy prostate cells, zinc inhibits certain enzymes so that citrate, a key component of semen, can accumulate and the cells remain non-cancerous. Dietary sources and recommended intake. Food is the best first step to getting enough zinc. Adult men, 19 plus, need about 11 milligrams of zinc per day, which is a modest amount compared to some other nutrients. Fortunately, many common foods are rich in zinc. The absolute richest source is shellfish. For example, raw oysters pack about 30 milligrams of zinc in a 3-ounce serving, nearly 3 times the RDA. Red meats are next. For instance, 3 ounces of grass-fed beef has 3 to 5 milligrams. Other high-zinc foods include poultry, turkey chicken, pork, crab and lobster, dairy, cheese, yogurt, milk, and eggs. Plant sources contain zinc too. Legumes, beans, lentils, chickpeas, nuts, pumpkin seeds, cashews, whole grains, oats, quinoa, wheat germ, and fortified cereals contribute significant zinc. For example, a cup of lentils or a handful of almonds might each yield 1 to 2 milligrams. Because meats provide zinc in a very absorbable form, men who eat meat generally get more zinc from their diet. But even vegetarians can meet their needs by eating a variety of beans, nuts, and whole grain foods each day. Absorption considerations. Not all the zinc in food ends up in your cells. Absorption can vary. One big factor is phytates, compounds in whole grains, legumes, and seeds that bind zinc and block its uptake. For example, men who eat mostly plant-based diets may need up to 50% more zinc to achieve the same status as meat eaters. Techniques like soaking, sprouting, or fermenting beans and grains can reduce phytates and boost zinc absorption. Also, taking extremely high doses of other minerals like 25 plus milligrams iron or 1,000 plus milligrams calcium at a meal can slightly lower zinc absorption. Finally, aging itself impairs nutrient uptake, so seniors naturally absorb slightly less zinc than younger adults. On the plus side, vitamin C from citrus, peppers, tomatoes doesn't harm zinc and may even help. The takeaway: focus on zinc-rich foods and use simple tricks. Example, adding lemon juice to a bean salad to maximize absorption. Zinc supplementation, benefits and risks. If diet alone falls short, a supplement can help, but it's a mixed blessing. On the upside, a zinc supplement, usually 15 to 30 milligrams of elemental zinc, can quickly correct a deficiency. This can improve immune markers, speed wound repair, and in men with low testosterone, it can nudge levels upward. Supplementation has been shown to help manage age-related declines in testosterone among older men, so it can be a useful tool for hormonal support. However, more is not better when it comes to zinc. The safe upper limit is about 40 milligrams a day for adults, and consistently exceeding that can cause problems. Chronic excess zinc interferes with copper and iron metabolism, potentially leading to anemia and neurologic symptoms. Common acute side effects of high-dose zinc include nausea, stomach cramps, and a metallic taste, notably with lozenges. Oversupplementation has even caused smell loss when used in nasal sprays. In sum, supplements should be used judiciously, only for a limited time or at low doses, and preferably under a doctor's guidance. Medication interactions and chronic conditions. Men over 60 often take medications or have chronic illnesses that affect zinc. Some antibiotics, like ciprofloxacin or tetracyclines, bind zinc in the gut, so they shouldn't be taken at the same time. Separate them by a few hours to keep absorption of both intact. Likewise, zinc can reduce the effectiveness of penicillamine, a drug for arthritis and Wilson's disease, if taken together. Thiazide diuretics, used for blood pressure, increase zinc excretion in urine, gradually lowering zinc status. Chronic diseases can also affect zinc. For example, diabetic or renal patients often lose more zinc, and conditions like Crohn's or celiac disease impair absorption. Vegetarians and vegans, common diets for health-conscious seniors, absorb less zinc due to phytates. For anyone on regular medication or managing a condition, it's wise to discuss zinc status with a healthcare provider. They may recommend a blood test or adjust zinc supplementation to avoid interactions. Signs of zinc deficiency. Men should watch for symptoms that hint at low zinc. Warning signs include slow wound healing and frequent infections. Cuts, bruises, or infections, like colds or pneumonia, linger longer when zinc is low. Hair loss or skin changes. Zinc deficiency often causes thinning hair or dermatitic rashes, dandruff, eczema. Loss of appetite, taste, or smell. Zinc is needed for taste buds and hunger signals. Deficiency can blunt appetite and the senses. Fatigue, irritability, or cognitive fog. Energy can plummet and mood or thinking can suffer when zinc is marginal. Reproductive issues. Low testosterone from zinc deficiency may cause lower libido, erectile problems, or poor sperm quality. If several of these occur, it's a clue that zinc, and perhaps other nutrients, should be checked. A doctor can confirm with a blood test and advise on treatment. Practical tips for older men. The good news is that small changes can make a big difference. To boost zinc intake naturally, add one zinc-rich food to each meal. For example, sprinkle pumpkin or sesame seeds on cereal or yogurt. Eat a 3-ounce portion of beef or poultry at lunch or dinner. Snack on mixed nuts, cashews, almonds, or enjoy seafood like oysters or crab a couple of times a week. If you eat plants, consider soaking beans and grains before cooking. Incorporate a bit of lean protein, eggs, cheese, tofu, in vegetarian meals. Supplements. If diet alone is insufficient, a low-dose zinc supplement, 10-15 milligrams a few times weekly, can shore up intake without risk of overdose. Take supplements with food to avoid nausea, and don't take them at the same time as antibiotics or high-iron pills. Be sure not to exceed 40 milligrams total per day unless supervised. For men with health conditions, like kidney disease or GI issues, start with even lower doses and get medical advice. By also focusing on an overall healthy diet, fruits, vegetables, lean protein, healthy fats, you naturally get nutrients that work with zinc, like vitamins A, C, and magnesium. In short, look for whole food ways to boost zinc first, then use supplementation as a backup if needed. A little zinc goes a long way for men in their 60s and beyond. Paying attention to zinc via diet or mindful supplements can support muscle strength, immune resilience, wound healing, brain sharpness, prostate function, and sexual health. These benefits add up. For example, just eating a few oysters or a couple of handfuls of seeds each week can meet your zinc requirement. Over time, such habits can translate to better energy, quicker recovery from illness, and more robust long-term wellness. Remember, it's the small, consistent choices that count. By choosing zinc-rich foods and talking with your doctor about any needed supplements, you can help ensure that this critical mineral isn't holding you back. In the end, a pinch of zinc and a dash of awareness can keep older men feeling vital and healthy for years to come.